real quick, tell us what Mitigate Partners is.
Wow, real quick. Okay, I'll try.
I'll do this when you talk too long.
Well, I'm gonna get used to seeing that. So Mitigate Partners is basically 20 benefit consulting firms that have come together to share and collaborate instead of compete all over the country. And a little over 400 years of experience between them all. And the goal is, you have your own shop in Ohio, but if we work together on a case or we collaborate, or like we have and went in a city in Florida, we had somebody in Texas, we had somebody in Florida, we had me in Georgia. We work together under Mitigate, even though we're all independent business owners, to come together to win. And we were sharing one mind's better. 4 minds is better than 20. Want to go fast, go alone. Want to go far, go together. Old African proverb. And that's really what it is. It's about local management too, Mike. So we want to have local management in these markets where we are, so we have boots on the ground.
Yeah,
and that's it.
Carl, knowing that we're both part of Mitigate Partners, the thing is what I think is important about that, and I'd like for you to echo it a little bit, it's you're not just 400 years of experience for the sake of aggregating membership, and there's no financial incentive to aggregate membership for some type of carrier override program. These are thought leading consultants whose sole mission, philosophically, we align very closely, but the whole mission is to vet out inefficiency and waste within the healthcare system to deliver value to the end consumer and the employer.
You've got to show them what the promised land looks like. They may not want to go there, but for you to decide not to say, you could save $5 million and you decide to play God that they're only going to save $1 million. I don't think that's right. That's being a broker, not an advisor. So I want to show them what it looks like. If they don't want to go jump in the deep end with cinder blocks on, they don't have to. But I think it's our right. We should show them, and that's what we do, and that's what everyone does. And if Mike Andrade goes, "Hey Carl, we got this cool plan. We got green imaging in Texas. You ever heard of it? It's run by a doctor, Dr. Dickerson. It's a great solution. Hey, we need to put it in fair cost. Thanks for sharing, Mike. Let's get it in there." Mm-hmm. That's what we do. And obviously they're already in there, but you know what I'm saying.
Yeah, no, I got it. It's a collaborative effort. We're all in.
Right.
At the end of the day, it's about how do we add value collectively to our customers and their employees. What is possible with an employer that may be looking for cash right now because of COVID, or maybe they're just thinking we must do something different, and their eyes are now more open with the fact that there are different solutions out there. But let's start with the savings part. What is a typical savings range that an employer could expect by adopting some of the principles that you have with the Fair Cost Health Plan?
I would say, Mike, real simply put, and I actually can answer this one pretty quick, 20 to 70%. I've been told not to say that, but we have a case study that you've seen that about 70%.
Yeah, so 20 to 70. I've never heard 70% that high, but so that's it. And so talk to me a little bit about how that's possible.
And things like that. That's where the utilization management comes in, Mike. We did a YouTube Zoom that I think you saw, where we were able to pull the pre-search for our clients during COVID, because everybody's being lulled to sleep. Hey man, look, my plan's running great. Claims are flat, they're way down. What's going on? And I'm like, nah, there's stuff going on. It just hadn't hit. So we pulled the pre-search, measured them against the data analytics platform of the claims, saw what had already hit and what had hit. And then we reached out to our clients, and we do deploy what we call a benefits champion we can talk about. And I reached out to them and said, here it is, here's your list. And we saw that, hey, MRI here, MR here, there, CT scans. So those could be precursor for things. So we were able to reach out and let the benefits champion talk to the actual member and said, hey, Mike, we see this is going on, and they're HIPAA officers, so everything is cool on that. They said, you might want to go to this ambulatory surgical center and then get with the cost and quality company, make sure everything lines up, and then consider that before those things get packed. Once the floodgates came open, elective procedures were allowed again, we were ahead of that, and we did that for all our clients. That's what we call active management. We can do that. If we're with a BUCA, Insura built, Blue Cross United Signet, and a Humana built plan, you aren't pulling any pre-cert list. You aren't looking at your analytics. And we did all that like that. That's simple. So that in itself is a huge difference of what can be done. And I will tell you, by doing that, there is no question our clients have saved money by doing it. And that's what we were presenting to our clients. Just one example.
Yeah, no, it's a perfect example. What I'm hearing is, what I've heard you say though, is essentially 16 point solutions. And that's,
we identified over that 7-year journey 6 fundamental flaws with the healthcare system, and you can add to them and you make it 7 or 8. I want you to, but the flaws are real simple. Number one was the cartel, and I could go into detail. I hope everyone can figure out what that is. Lack of pricing transparency, medical billing errors, the traditional PPO discount game, the pharmaceutical shell game, and lastly, lack of information and data. So what we did is we turned those 6 fundamental flaws into opportunities. And we've given a lot of talks around the country, the 6 opportunities in healthcare. I did it at the Free Market Medical in Houston, where you are, for Dr. Dickerson when they had me out to speak July of 18. So we've done that talk a lot. That is what the Fair Cost Plan does. It solves all of those flaws. And that's where you can save 20 to 70%. If you only want to solve 2 flaws, maybe you don't save as much. So that is what we were trying to attack with the plan. And we believe we've got the best high-performance healthcare solution partners in this mix. But what's important, Mike, is you've got to have them working and playing the sandbox together.
let me push back a little bit, because what I'm hearing you say, you've got these great point solutions that work together. And if I'm listening to this, I might be thinking that's BS, because fill in the blank, United Healthcare, Blue Cross, Cigna, they have so many more point solutions, and they've got this ginormous universe of stuff. They should be able to organize and whoop your ass when it comes to quality and outcomes. What's your response to that?
The gig is up. I'm a fake. You figured it out. Don't tell anybody.
No, but seriously, there's people thinking that, right? And so talk to me how Aether, being the least sucky TPA, how do they know how to channel the right resource? And so maybe, you know what I'm saying?
Yeah. Well, we have two entry points. The advocacy program they have, and
Right.
a cost and quality solution that all the members have to call on any pre-certed or elective procedure. If they do not call, they will get penalized for not making that call. So therefore, we can catch a lot of these things up front. With the support of of Aether as well, we're able to catch these things up front, Mike. And before a claim becomes a claim, we have all hands on deck. And I'm going to tell you right now, and you get me fired up now, because when you're challenging my integrity. If you think the BUCAs are doing that, okay, I can tell you, we work with the school district. 2 months ago, we had a $3.2 million heart transplant. $3.2 million heart transplant. We heard about it 2 months ago. That's the first we heard of it, Mike. That's the first we heard of it. Don't you think that person knew for a good long time they were in a heart transplant? If that's what you call BUCA utilization management, my friend, good luck with that. Let me know how it works out for you.
Yeah, no, Carl.
Well, wait, that was paid out at $2 million. Stop loss is $1 million on this case. $2 million, $1 million. In our fair cost model, that call would have gone into pre-cert. We would have been notified. Aether, cost and quality, our network development partner, everybody, the client, would have had all hands on deck, and we wouldn't have paid more than $300,000 for that procedure. I promise you. Yeah. That's the difference, Mike. So there's $700,000 of savings like that.
And many times what is missed is the opportunity to make an interception or to make a redirection. In the typical healthcare equation, when somebody has something that needs to be done, there's a phone call that happens. It's a prior authorization or pre-cert. And that is such an amazing source of data, because you can use that to positively influence the outcome. So you can avoid the 30 to 40% of surgeries that don't need to happen by having a proper touch point in place. You can help redirect folks that are going down the hall to whatever hospital system's MRI and save thousands of dollars by repeating that redirection over and over and over again. And so I totally agree with you. That's why we work together. It just seems that there's a lot of employers that are out there that haven't really gravitated towards the fact that they write a check and they can do so much with their health plan. And so let me ask you that. What do you think in your mind is the biggest rub as to why more employers aren't adopting plans like yours? Is it lack of knowledge or is it more fear?
Yeah, I told you about that Winning Healthcare Food Fight podcast this morning by Hunter Schultz. It was interesting because he asked the same question, and the reason I'm only bringing his name up is this. He asked it about school districts, municipalities, and private employers, and he asked about each category and why. Mike, I think the simple, and I can answer this real quickly, is the pain isn't great enough to make change. And you and I can go out there and show all this great stuff, show millions of dollars of savings. And a lot of people that know me and know you go, man, y'all ought to just be killing it with this. Man, this thing planned, these videos, my gosh, look at what you've done for these employers. Not the case. Not the case.
When I hear you say cartel, to me, that means traditional brokers, insurance companies, pharmacy benefit managers, and even some healthcare providers. You kind of lump into that. But when you call them cartel, what are you affectionately saying?
Well, what I'm saying is the only people sitting at the table with an employer that want the cost to go down are the employer. Mm-hmm. And all the rest of the cartel members make more money the more the costs go up.
Yep.
So it's all misaligned incentives. We could talk about the MLR rule. That's a laughable thing. I mean, we can talk about a lot of this stuff, but you nailed them all. And I was a part of the cartel. So let me be clear. I was a part of the cartel too, because I didn't know better, but I looked and dug and I got out of that, and everyone else can too. It's absolutely possible. But a lot of people do, turn an eye and they don't want to change because, buddy, when you passively manage a health plan, you're on the golf course a lot quicker. You're in the deer stand. You got a line wet in the lake. You're doing a lot of that stuff right now. When you actively manage plans, you're helping people. You're helping somebody get from a cartelish hospital, most expensive hospitals in Florida, to a long-term acute care facility in LTAC. And the only payers in the healthcare system are the employers and the employees. Those folks, the cartel, are processors of their money. Don't give them the dignity of calling a payer. We identified over that 7-year journey 6 fundamental flaws with the healthcare system, and you can add to them and you make it 7 or 8. I want you to, but the flaws are real simple. Number 1 was the cartel, and I could go into detail. I hope everyone can figure out what that is. Lack of pricing transparency, medical billing errors, the traditional PPO discount game, the pharmaceutical shell game, and lastly, lack of information and data. So what we did is we turned those 6 fundamental flaws into opportunities. And we've given a lot of talks around the country, the 6 opportunities in healthcare. I did it at the Free Market Medical in Houston, where you are, for Dr. Dickerson when they had me out to speak July of 18. So we've done that talk a lot. That is what the Fair Cost Plan does. It solves all of those flaws, and that's where you can save 20 to 70%. If you only want to solve 2 flaws, maybe you don't save as much. So that is what we were trying to attack with the plan, and we believe we've got the best high-performance healthcare solution partners in this mix. But what's important, Mike, is you've got to have them working and playing the sandbox together.